so much. My name is Sarah Enzaldo Smith. I'm a physical therapist at St. Francis in West Ashley. Let's see, there's a little bubble on here. So appreciate your feedback. Okay, all right, cool. All right, thanks for the introduction. And so nice to be here. This is actually my first talk ever, so I'm really glad to be here. All right, so a little bit about me. I'm from Los Angeles, California, but grew up in Beaufort. I went to Anderson College on a soccer scholarship, and then made my way to MUSC for physical therapy school. I've always been passionate in human anatomy and learning about just the human body in general. Kind of knew in 7th grade that I wanted to be a physical therapist after a fair came through and kind of fell in love with the whole idea of helping people. I've been in practice for 15 years, mostly in manual therapy, using my hands to help people. 13 years at St. Francis, outpatient care, but also acute care. I have been injury-free, mostly, and I'll get back to that. It's funny that you mentioned CPR, but we'll get back to that. Ergonomics. Does anybody in here have an idea of what or why ergonomics is important and what it might be? Anyone? Okay, so it's basically just the study of people in their work environment. If we have proper ergonomics within the work environment, it helps to boost the workplace efficiency and individual productivity, keeps employees happy. We want to fit the job to the worker, so that means these beautiful chairs that you guys have with nice lumbar support. Things such as, I brought these in, you guys are more than welcome to kind of take a look. Ergonomic keyboard. Does anybody have one of these? Might be a nice addition. I did develop some wrist problems. I came back from having a knee surgery, typing up a bunch of evals for 3 or 4 a day, and just started to notice that my wrists were bothering me. So I just went on ahead and bought one for myself, along with an ergonomic mouse, which has really been helpful. So you guys seem to be really up on the ergonomics, and I'll pass it around, but keeps your wrist in neutral, okay? When you're flat on a mouse this way, you're constantly rotating this radius bone, which can put stress at your elbow. So again, I'll kind of pass it around if you like. But it's been very helpful. So again, tools, the equipment, workstation setup, super important. Anybody here have a standing desk? Awesome. Very good. Okay, so why is it important? So mostly costly. Whenever we have an injury, you've got to set up the what do you call your incident report, right? Incident report takes time out of your production, out of your work. It's costly. You're going to have to set up an office visit with a doctor or a nurse, paying for imaging, paying for physical therapy. Again, hours out of work, loss of production. Get an injury at work. It could be a recurring or persistent pain in the future. I've had tons of folks who come to me with an acute on chronic back pain issue that stemmed from something they did 10 years ago at a workplace. So again, sometimes one incident can lead to chronic issues. Repetitive motion, also within the top 10 most common workplace injuries. And I'll get back to my CPR little injury. We used to have, taking CPR classes every 4 years. They used to have, but now have since taken out, and I'm assuming because people were getting hurt, we used to have to do a 10-minute drill. So it's a group of people, basically 2 folks are on the dummy for that full 10 minutes, and I was one of those people on the chest. So 10 minutes, constantly going back and forth. Went home, my wrist started throbbing, went and did the whole employee filling out the form, went and saw a doctor, took time out of seeing patients. They paid for an MRI. I got an MRI on my wrist. Everything was fine. But again, it's those persistent and it's those things that are repetitive that we do that can cause injuries. Most folks in here are sitting at a desk for their jobs. Yes? Okay. All right, so common work-related musculoskeletal disorders. It can affect muscles, joints, nerves, blood vessels, ligaments, and tendons. Some of the symptoms can include some discomfort, pain, numbness, tingling, loss of motion, flexibility, stiff joints, burning, swelling, inflammation, and throbbing. Has anyone gone home with some neck pain from work? Possibly back pain from work, possibly. Yep. I'd be happy to come and look at your setups. I would really enjoy that. Okay, who's got back and neck pain? How about these guys here, right? So, good try here, but lots of back, lots of flexion there in the spine. It looks like his back does kind of hurt a little bit there. And the gentleman here kind of just sitting on his spine, tailbone's kind of hanging off the chair there, so definitely not good setups. So a little bit about spinal anatomy. So one takeaway I want you guys to remember is trying to maintain what we call the S curve. So the spine has kind of lost its S curve a little bit. But here we've got your spine, front and the back, your sacrum, kind of your tailbone here. You've got your cervical spine here, made up of 7 cervical vertebrae, your thoracic spine, and then finally this lumbar spine, which should be kind of curved in as so. So that's kind of our S curve there, okay? We also want to talk about vertebral discs. Has anybody in here had any disc issues before? Any radiating pain down their legs? Anything like that? Or have had friends that have had it? Yes, I saw one hand. All right, so we want to think about the disc material here as like a jelly donut, okay? So this outer ring here, you want to think of like the cake material. This blue, this nucleus pulsus is more like the jelly material. And then we want to think about spinal loading. So when we're sitting, when we're standing, when we're lying, standing up, sitting, bending over. So here we have 2 spinal vertebrae stacked on top of each other. And you'll see the spinal discs is kind of this like little dark area here. So here and here. And that's basically what's taking the brunt of load when we're sitting, lifting, standing, etc. Now, if you also imagine outside of this vertebra here, or this spinal model, we also have nerve roots. Nerve roots, they branch out of these little foramen, or spaces or holes here in between each disc, each vertebral body. Branches out from your spinal cord and gives our arms and our legs a supply of musculoskeletal muscle use, movement, and then sensation, kind of numbness, tingling, feeling, hot, cold, things like that. And these are those nerves right here, okay? So can you guys kind of imagine that coming out of those holes there? Again, we talked about the spinal load, and here is a nice, I really love this picture because it really shows different postures and how much load and compression is put on those jelly donuts that are in between each of our vertebral bodies. So if you look here in standing, and this was measured between the 3rd and the 4th vertebra, so pretty much kind of your low back pain area, kind of right around your waistline. So this study was done, again, just looking at the load, the compression, you can see on the bottom here, nice healthy load on the disc, and then here we see a squished disc, okay? So this is what happens when we sit with poor posture. So you'll see in standing, 100% nice load, nice spring load in the disc. 105, once we just start sitting, we increase that by 5%. Increasing the angle here of sitting forward at 100 degrees goes up to 115. At 90 degrees, 140%. That's a lot of load there. And then as soon as we start feeling that pull of our screen at our computers, we are up to 190% load on the vertebral discs. So that's where you are starting to worry about bulges, herniations, radicular symptoms, that numbness, tingling I was talking about. Little PSA for everyone who has cell phones, who has tablets, right? How many of us see kids walking around like this on their phones? Even worse, I mean, I have seen nursing students, I've just seen students and families and team members just, I mean, head down, just looking at their phones. So please, by all means, if you're a reader, if you do, if you're a sewer, if you do anything with your hands where you have to look at something constantly, put it at eye level, okay? So I'm sure you don't want to do like crocheting up in front of your face, but propping some pillows, getting something out of your lap and breaking up this kind of just flexion on your neck. Does that make sense? So sitting up, bringing the cell phone in front of your face. Please, or we're going to be seeing a lot of folks in the future. All right, who goes home and gets the cell phone, gets the comfy clothes on, gets those legs up, head curled, and looks like a cooked shrimp? I know I do. I am guilty. I am completely guilty. Or you do the Netflix binge and you're sitting in a chair, lounge for a couple hours. I know from experience I have binged for a few hours watching things, and I have Netflix back the next day, and my back pays for it. But I fortunately know what to do to correct it. But yes, that your posture has a direct effect on your spine. Direct effect. So you see anybody shrimp sitting, call them out on it, okay? Again, another nice picture here with the anatomy of sitting. Sitting again, that rounded spine, we want to keep in mind where the pelvis is. So if that pelvis is rounded, it's going to start putting a lot of pressure on the lumbar and the cervical spine there. We want to try to maintain a nice flat back. Again, beautiful support here in these chairs to your lumbar spine, which is going to decrease the squishiness onto those vertebral discs. All right, so why your posture matters. So sitting upright. So again, I tell all my patients it starts from the bottom up. So there's so many times where I go and see and I grab people from the waiting area, and they could be coming for whatever, and the majority of them are sitting like this, okay? So I am sitting on my tailbone, basically, okay? So we are going to find our proper posture here. So if everyone will indulge me, let's everybody sit up. And I want everybody to kind of feel on the seat. We're looking for these ischial tuberosities here, your sit bones, okay? So if you feel like you can't find them, go ahead and put a hand under, and you will squish your hand, okay? Those are hard prominences there, okay? So we want to sit upright. Once we start to kind of correct where the pelvis is, everything just kind of lines up, okay? I want you to arch your back and then back off about 50%. That's pretty much your neutral spine, and that's pretty much what you should be trying to maintain during the day. Now, not everybody can do that all day long. I can't do it all day long. I'm not saying be like a robot and sit like that all day, but you can start building endurance. So a tip that I have my patients do every meal, I tell them to scoot to the edge of the seat to where they're kind of forced to sit up, okay? So no one wants to eat a meal like this, okay? So always scooting to the edge of the seat can be helpful. Bringing yourself, arch your back off 50%, and then try to eat your meals there. Over time, you'll start to build some good postural endurance, okay? Yes, build your endurance slowly. Again, I don't expect for everybody to sit like that the entire day, okay? Because then you'll definitely come and see me. So go slow. Yeah, it takes time. It really does take time. Okay. Everybody's desk setup looks like that, right? Pretty much, okay? So back's nice and straight, nice back rest, keeping that curve in that low back. The hips are back. Again, hip position should be all the way back. Adjustable seat height. We'll go into the next slide will show some good info on what kind of flexion extension you should have in your hips, but the arms you want relaxed to the side, about 90 degrees. A lot of my folks that are using laptops, that's a huge issue at home, because they're usually here in the lap or up on a countertop like this. So I'm always asking people to buy some type of stand for home, an additional keyboard, so that they can maintain that nice 90 degree in their elbows. So nobody should be like this. Nobody should be leaning. This is pretty much the optimal position you should be looking at. Do you guys have any of the foot rests here at all? Foot rests? Yes. Does that feel nice? Yeah. Yes. Very supportive. Very good. Okay. Again, going back to kind of those top 10, we want to minimize the fatigue or static loading. So having an option to sit or stand is great. I have set myself up at my workplace. I've got a desk office where I can sit. And then when I start feeling lazy, I come out here and stand. Or if my back starts hurting, I come out here and stand. So it's always a good option. Prolonged static loading for hours can cause muscle fatigue, especially in sitting. And then we saw how much load sitting puts on the spinal discs, right? So standing is going to bring it back down to 100. Hand or wrist cramping while typing or typing too long. How many of us are resting our wrists on tables or desks? So we all know that is not optimal. Should be 90 degree bend in your elbow, wrist should be up, right? Anybody lifting, digging, reaching overhead or below the waist throughout the day, they need to take breaks as well. Set a timer. I have a lot of my folks setting timers. So set a timer on your laptop, on your cell phone, something that's going to remind you to get up. Having a water bottle can be very helpful. You finish that water, you walk to the water station or whatever, get a nice stretch, and then come back to your desk. I heard you guys even have like a walking path out here, which is awesome. Take advantage of that. That's great. Exercise or stretch, and then again, changing positions at a standing desk. I've also bought for myself an anti-fatigue mat. Does anybody have those like in their kitchens? Something like that could be really nice and helpful for someone who's standing all day. And also good for anybody who's got arthritic joints, knees, hips. Again, just kind of minimizing that impact can be helpful. Okay, you guys all done eating? So we're gonna exercise now. Just a little bit. So, and I'll pass this along to Brandon so you guys can kind of disseminate it if you'd like. But I've also found a YouTube video. There's tons of them on YouTube. You can just Google or YouTube 5-minute desk yoga stretch, something like that. That can be very helpful. I will say the one beef I have about this one is there's no standing. So by all means, take the time to stand. If you are sitting, like I said, for an hour at a time, set a timer just to stand up, unload, rotate, etc. All right, so has anybody done any yoga before? Yes? Okay, all right, cool. All right, so let's all come to the edge of our seats. All right, we're gonna try this. This should only really take you about 5 minutes, okay? All right, so we're gonna do this first one here. Here, inhale to the arch your back up. Take a nice breath in. And then we're gonna exhale and round your spine. So this is basically a seated cat-cow stretch. Big inhale, looking up, arching the back, and then a big exhale, and you're rounding the back. These are some I use myself. Now we're gonna try this little spinal twist here. So take a leg, cross it over. Opposite arm as leg comes across. Okay. Here, I'll do it. Sometimes it's helpful if I do this. All right, everybody cross the right leg over the left. Left arm is reaching across that right leg. And we're going to try to look over that right shoulder. Try to look behind you. Yep. It gets better, I promise. Deep breath in and out. Good. And let's do the other side. Left leg crosses over. Right arm is coming across that left leg. And you might get a couple of those little pops or cavitations. Those feel amazing too. Deep breath in and out. And come on back. Great job. Okay, this next one here, interlacing our fingers, arching the back. I like to do this one standing, but you can do it sitting as well. But again, clasp those fingers behind your back. Roll those shoulders down and back. And then really just try to look up and open up that chest. Again, we do so much here during the day. Not enough here. Who can touch their hands back here? Everybody touch their hands? Okay, good. Okay, next little side stretch. Good posture. I like to grab the side of the chair, reach one arm up, and just give a nice stretch to the side. Deep breath in and out. Good. And stretch over to the other side. Awesome. All right, very good. Again, these are great. They're very similar. I like the back and shoulder stretch. Again, if you're at your desk and you just need to fold forward, that's a great one. Try that. These nice neck stretches here for us looking at computer screens all day. Again, just some real gentle motion. So it doesn't take too long. It doesn't take, just a little break is great. Great for your back. You only get one back, guys, so you really got to take care of it. Really, really do. Okay, let's go into some lifting mechanics. So, can I get a volunteer? Trey, okay, sounds like it's Trey.
Christina.
Thank you, Trey. Thanks for nominating Trey. Okay, so this isn't a magic trick. This is a 6-pound weight. Or do you have issues at back issues or shoulder issues? Okay, now you know. Okay, try not to create one. Okay, so at first I want you to hold this weight in close to your body, all right? And then you're going to bring that weight out in front of you. And tell me what you feel happens to the weight. I hope you say the right answer. Does it feel different? Does it feel heavier? Yes. Because we So we have now put the fulcrum at his spine because we are increasing the lever arm, okay? So now I've got this weight away from my back, away from my body, pulling on my back, okay? So that's what we really want to try to avoid when we're lifting. So your next task is to show me how you might lift this box. If it weighed 5 pounds, if it weighed 500 pounds. If it weighed 500 pounds, you would ask for help or probably get a machine. But let's just see how you might lift this box. Okay, and then how would you put it down? All right, good. So we'll give you like 85, 90%, pretty good. You got your bent his knees, you got down low, kept your back relatively straight. But you do what a lot of people do. You're not alone. So I have a lot of folks who, again, they increase that lever arm and put their backs at risk. So I have a lot of folks that show me, and they do this, they bend their knees, they lift it, and then they put it down, and they take the weight away from their bodies, again, straining the back. So what I like to tell people is, let's go to the next slide, actually. Okay, get in as close as possible. So not even feet behind, because here it's still somewhat in front of my body, in front of my back. So I like to tell people to get into a wide kind of sumo squat so that I can go straight down, okay? So you're keeping the head up. I'm going straight down, bending my knees. I'm going to use my legs, only my legs. So squat, lift, and that is kind of your proper lifting mechanics, okay? To put it down, I just let whatever it is just kind of ride down, again, squatting, and coming back up. You want to try? Now that you really know how. Those are my shoes. No, sometimes lack of flexibility in the ankles and somewhat in the back can have an effect on your lifting mechanics. Ooh, that was great. Okay, I'll sit down. Yeah, very nice. Very nice. Very good. Thank you so much for helping us. Okay. Does that make sense? Any questions about that? Okay. So when we're all pulling out our Halloween decorations, okay, or Christmas boxes and all that stuff that's about to happen, please think about that, okay? Keep it in close, even if it's a bag of dog food, mulch, toddlers, babies, kids, anything, keep them in close. You never want to reach out and lift. Always get in close and pick it up straight up. Okay. What else? And again, get help if it's too heavy. Get that teammate help. Okay, again, things to remember. Sit up. We want to maintain that S-curve. Take a look at your desks, and I can also come around after this to see if your desk is set up correctly or optimally. Take breaks, set the timers, get up and move, refill those water bottles, take the yoga stretching breaks. Use your tools. I'll actually just leave these up here. You guys can check them out. Use your tools. Think about, this was a flash sale on Amazon for $20. Well worth it to me. Probably use your HSA on it. And the keyboard. That's ergonomic as well. A little bit of a learning curve, but now that I've gone back, if I bounce back from keyboard to keyboard, I feel it right here. So this has been really nice to have. Again, with the lifting, stepping in close, squatting with the knees, lift with your legs, and then ask for help if it's too heavy. Don't overexert yourself. Don't push yourself to pick up those last 5 boxes or whichever. Just keep that in mind and just be smart about things. All right, I think that's all I have for today, but I'd be more than happy to answer some questions, or if anybody wants to come and do the fun weight magic trick, that's kind of cool too. It really is an eye opener. So if you do have a little dumbbell weight at home, I would say like maybe a 5 or 6 pound weight, try it at home because you will see how much it really pulls on your back. I have all my patients do that, and it really is pretty eye opening. So thank you guys so much. That was great. Everybody was so helpful. And